Welcome to The Milk, the podcast that pours it all out, the messy, the magical, and the mildly unhinged moments of motherhood and womanhood. Real talk, honest stories, and reminders that none of us really know exactly what we're doing, and that's kind of the best part. I'm Taylor, your host and soon-to-be mom of 3, so let's laugh, learn, and milk this season of life for all that it's worth. Hi ladies, welcome back to another week on The Milk. Today I am actually setting up shop in a very cool location that I've been going to weekly, and we're getting into a little bit of traditional Chinese medicine practice. I have my acupuncturist, Dr. Christine San Miquel, with us today. I'm actually getting a session done with her after this because we are working on labor prep.
Yes, ma'am.
So acupuncture has been something that has helped me so much. One, just in my life, but then so much more even in my pregnancy journey that I was like, wait, I have to share this with everyone who isn't familiar with acupuncture, or maybe you are and just, have it here and there. So we have Dr. Christine here to spill all the tea on all the benefits of acupuncture and how it can support a woman's life from fertility to through the different stages of pregnancy and then also ending in postpartum. Yeah. So welcome to the show.
Thank you so much. I'm really thrilled to be here.
Do you want to give a little background on what you do? Because you're not just an acupuncturist.
So I do practice acupuncture. I'm a doctor of traditional Chinese medicine. I'm also a doctor of medical qigong, which is more of the energetic side of the medicine, more like meditation and mindfulness. Also a research professor, so I like kind of both sides, like the more woo-woo energetics and also the nerdy like research stuff.
I feel like you gotta mix that. Like that's so fun.
I love both. I think they play really well together. So I enjoy sharing that with patients too, because I get a variety of, people interested in different aspects. So a lot of my work has to do with supporting, just the whole person and having a bigger, like a pattern-based support, right? So it's different for every person that comes in, what that support looks like. Some people need a little bit more of the emotional side of it, and some people need a little bit more of like the give me a plan, show me the research
clinical approach.
Yes, more clinical approach.
Yeah,
and I love both.
That's what I always look for. Like I love the woo-woo stuff.
Yeah.
I can get woo-woo, of course. But then I'm also like, all right, show me the receipts, show me the backing, show me the research. Yeah. So I love it.
Yeah.
Do we want to start with, for anyone who is acupuncture curious but has no idea what's going on,
yes.
Do you want to explain what acupuncture does to the body?
Gosh.
Loaded question.
I know. I look at acupuncture as working with the body's own energy and being able to create an environment where the body is going to naturally move towards healing. So I think in this system of medicine, kind of the basis is that the body wants to move towards balance. Like water is always going to want to move towards the lowest place, right? Same idea. And so by using acupuncture, we're looking at where there's too little energy or where there's too much or where something might be blocked. And then we're able to choose points specifically for that pattern and then support the body to be able to be in an optimal state. And that's always kind of moving, right? Like we're never in a static, stopped position where everything is balanced. So I always say like everyone really could benefit from acupuncture at some point, but
yeah,
there's also periods where I was just reading a research study that was looking at stress and anxiety, and it followed patients for 8 sessions, and then it did a follow-up afterwards 3 months later, and the effects were still there. And I think that's something that people don't always think about with acupuncture, is like, oh, I have to keep going. But the idea is actually that your body will, the pieces that are supposed to be working in a certain way will kind of turn online, and then they'll be able to carry that forward.
Oh, interesting.
Does that make sense?
No, I always thought that to experience the benefits, you had to keep going.
Yeah. So that's something I'm glad to be talking about these things more, because it's a really amazing part of the medicine that I don't think gets enough conversation.
No, it's so true.
Yeah.
I feel like so many people leave after acupuncture feeling calmer, more regulated, and almost like something has shifted. Why is that so?
I think partly because it works on the nervous system. So acupuncture is interesting because it doesn't fit in a box of like, this is exactly how it works. It's like there's several different theories about why it works. One of them is that it works with the fascia in the body. And that's why like someone can come in for nausea and stomach things. And I'm going to do points on the wrist because there's a connection between those things.
Okay, wait, I want to stop you there because
Yeah.
I've always wondered, like, you check my pulse every time.
Right.
And then you do things on my wrist. So, like, do you want to run through what points on the body are for what? Is that a thing?
It is a thing. So in acupuncture training, we spend like a year of dedicated like every week classes learning all of the points and like what they do. I think of them as like they all have particular like personalities or functions, and we can call on those when we need them like as a single thing. And then there's also like point combinations. So sometimes you call on like certain friends to get together to have a certain effect on the body.
Oh, so they work
so
together.
So they work synergistically. So sometimes I'll put in I always will put points in like a certain order in the body, and that might be different each time someone comes in because I'm trying to like, okay, this, the digestive system needs a little support first, or like the hormonal system needs a little support first. Then I can start moving things because there's enough energy there to support that movement.
Got it. Sense? When you put them in the head, what's that for?
So the one that we've been doing,
sure,
at the top of the head actually is able to raise the energy in the body. So we use it a lot in early pregnancy to help hold the pregnancy. And, I always think of it like a sticky baby point, like it's holding everything up and in. And then we also can use it in cases of high blood pressure. So when a woman, especially in pregnancy, gets high blood pressure, that's kind of scary. And so we'll use that energy with a different needle technique, and we'll push the energy down.
Wow.
In that specific system, not in the, you know what I mean? Like it wouldn't threaten the baby.
Totally.
But because it's combined with other points that have to do with blood pressure, it will help lower the blood pressure.
Okay, and one more. What about the feet?
So many points on the feet. In pregnancy, so many points on the feet. I think the feet are interesting in Chinese medicine because in fertility, pregnancy, postpartum, just general life, we always tell people, like, keep your feet warm. Like the fact that you have fuzzy slippers on right now, I was like, yes.
I'm in my like comfy
slipper
phase.
shoes. I was like, yes, comfortable and warm feet. So the idea is like the bottom of the foot is where the energy comes in from the earth and comes up the channels of the leg to the womb. So especially for women's health, we want to make sure that the womb space is warm. And that's why we're always saying, like, keep your feet warm, keep your belly warm, keep your low back warm.
Oh, wow.
And that all supports fertility, pregnancy, and postpartum especially.
And so that's why you put the warm heater on my feet when we have sessions. I always wondered. I was like, maybe it's just like a nice way of you not wanting me to be cold.
Cozy. Yeah, it's also a cozy factor. I love that too. Because the more relaxed we are, the better the energy will flow in the body.
Yeah.
So the easier it is for that kind of relaxed sensation to come through. And there's also an aspect of hormonally, if we have stress hormones that are really high in the body, the sex hormones are going to have a harder time functioning optimally. And that's, a lot of different cascades of things. But, kind of the shorthand version is like, when you're less stressed, your hormones will be happier.
Yeah, of course. Of course.
Yeah.
Okay, so for someone trying to find an acupuncturist, let's say someone pregnant or postpartum, are there specific things they should look for in this acupuncturist? Is it like credentials? Is it someone who works specifically with pregnancy, women, postpartum?
Yeah.
What would you say to someone who's like, I want an acupuncturist, but I have no idea what to look for? Yeah.
Right. Well, I think in California, it's nice because to be licensed in California, there's a pretty rigorous standards in place. So like, you can kind of guarantee they'll be skilled at what they're doing. And then beyond that, looking for someone who is really familiar with fertility, pregnancy, postpartum, and either has a lot of experience under their belt, or sometimes they'll have certifications in addition to the regular licensing. And at the end of the day, I think that a lot of it has to do with your relation, like your energy with the practitioner. So like, yes, you want to make sure they're licensed and like have the training, have experience in these things, because there's different, you know, red flags. There's different things that you need to know when to refer and that kind of thing. And then there's also just you feeling comfortable with your person, right? Like acupuncture tends to be a more, I don't want to say intimate's not the right word, but like...
But kind of. It's almost like, I put it in the same realm of like a massage or a therapist, where you also want to make sure the person who's like touching and working on your body, 100%. Like you have a good vibe with them.
Yes,
you feel safe.
It is about the vibe. Yeah. You want to feel safe. You want to feel comfortable. You want to feel cared for at the end of the day. I mean, I feel like everyone should feel that with all of their providers, but, you know.
Yeah.
But I think, if you're unsure, like calling them and asking to do a consult is nice. Most practitioners will hop on the phone, for 15 minutes and talk to you. Yeah. Answer questions, that kind of thing.
Okay, so jumping into fertility.
Yes.
So I want to start here at the kind of beginning before we dive into pregnancy and postpartum.
Yeah.
So for a woman struggling to get pregnant, what are you as a practitioner looking to support in her body? Are you looking to help regulate her cycle? Are you looking to help with hormone support, nervous system regulation?
100%. Yes.
Okay, let's dive into each one because I'm so interested in this.
So I think they all play together. So especially, women's bodies, they're complex. And the energy, because we have a menstrual cycle, the energy each week is a little bit different. So when I see someone initially who's wanting to conceive, we want to find out what's their particular pattern. And I think that's another thing in Chinese medicine that's often under talked about is this idea of patterns. So I could see 3 different women who have PCOS, and they might have 3 different patterns of PCOS, like reasons why that particular thing is showing up in her body. And so therefore, like the points that I would pick would be slightly different. There might be some overlap, but like the treatment plan would be kind of different because it's an individualized medicine.
Interesting. So you treat every individual literally individually.
Yes. Yeah.
There's not a pattern. Like you can have the same issue and your goal is different, or how you get to that goal is different.
How we get to the goal is different. That's a great way to put it. Yeah. And there are some protocol-based things that we do, like if someone chooses to do IVF and they're getting ready to do retrievals and transfers, there are research protocols that I'll use as kind of the basis, like the base of the scaffolding of a session or a treatment plan. But then when they come in, I always tell them, like, we're going to do this treatment protocol to help with your retrieval or the transfer. And then we're going to build on that and add points for, if your sleep is really off or your mood is terrible or your digestion's like constipated, whatever else is showing up, we can support that too. So it's a bit of a blend of that kind of individualized care and utilizing the research and stuff that's out there.
Yeah. So if someone has an irregular period, they can come to you for acupuncture to help regulate it.
Yes.
How long does that typically take? I know everyone's different.
Yeah. Generally, I'll recommend about 3 cycles. And I think that's fairly standard for most acupuncturists in this field or in this specialty. We'll want to see kind of the life cycle of the egg, actually. So the egg that a woman releases in a month started that kind of process of maturation 3 months ago. So we want to kind of work with the energy each week and then be able to start mirroring that. If it's irregular, we want to move it towards being more regular. So we want to kind of mimic where the cycle would be energetically. Does that make sense?
Yeah.
Like, I feel like that's a more common conversation now, which is cool. Like the cycle syncing and having that, like, okay, my luteal phase, I'm going to do more exercise that's restorative and, not going fully hard, but like follicular phase, I can go super hard and like do HIIT classes or whatever. You know, like rock out a spin class is great.
Mm-hmm. So if someone's coming to you and is like, I am going to ovulate soon, I'm hoping I can conceive this month.
Yep.
What's your goal in setting up the body for that?
Yeah. So and that happens a lot too, because people will hear, oh, acupuncture is good for this. And then they'll come in, they're like, I want to do it now. They don't know about the 3-month ideal runway. So in that case, we support what's showing up right then. So I'll do points on the body to support that being a really full and clear ovulation. And then working on moving any like stuckness in the body that might be preventing either ovulation or implantation. So that's really the focus then, is like making sure there's enough kind of oomph for the body to release an egg fully.
Oh, that's so interesting.
Yeah.
Okay, so pregnancy.
Yes.
There's so much to talk about in this topic.
I feel like
Acupuncture,
I could talk to you for hours.
Right?
Like, blah, blah, blah.
So what are some of the most common reasons that women come to you? Let's start with the first trimester.
Yeah, so first trimester is preventing miscarriage, probably one of the biggest ones. And there are some really nice points to help with that, like making sure progesterone levels are high, that kind of thing, and the body's warm. And then working on the fatigue and nausea that often come with really healthy pregnancies. Working on those side effects can be really beneficial so that we can still function out in the world.
Yeah, I will say that I discovered I was an acupuncture junkie when I was pregnant with Aspen. And my girlfriend, who's like an herbalist, acupuncturist, she was begging me to come in. And I was like, I am so sick. I can't even get in the car to drive. Yeah. And I think it was like week 9 or something, after a few weeks of being sick, I finally got the energy and I went in. And with one session, the next day, I felt 80% better. Yeah. And then the next day, I felt 90% better. I never got to 100. But then...
But that 90% is remarkable.
Oh my gosh.
And like just how you could do the things.
And then I would start declining after 5 or so days, and then I'd go once a week. Yeah. And it honestly got me through the first trimester. And I think with Bash, I did go a couple times, but I wasn't as nauseous. I don't know if it was because he was a boy. Yeah. But then this last time, I don't know. I think my mind was just elsewhere. And with the two other kids. And I remember driving, and I was like 11 or 12 weeks pregnant. Yeah. And I was like, oh my gosh, why have I only just thought of acupuncture now? And anyways, that's how we got connected.
I was gonna say, I'm so glad you had that thought.
And I was so upset. I was like, I've been struggling for so long. Yeah. And it completely slipped my mind. But from personal experience, like even just the first session, I felt so much better.
It can be really remarkable like that.
It's the nausea and fatigue.
Yeah. And brain fog.
That too.
Yeah. Sleep stuff, digestion, like all of it can really be so much improved.
So for women who are consistently coming to you, pregnant or not, everyone, you can meet them where they're at any stage. What are some of the benefits that you see them experiencing by coming consistently?
Such a good question. I think one of the biggest things is that ability to kind of bounce back, right? Because we're not going to stay in that place of like neutral balance, like Zen all the time, even though that sounds like a nice thing. That's not real life, right? Like stressors are going to come, life's going to show up, our body's going to respond in a way that throws it out of balance. And I find that the women who come more consistently with their care, even if it's like once a month for a tune-up or like once a season, but they have those like touch points, they're able to notice earlier when their body starts to go out of balance. And then they have some tools through learning, right? And like having these conversations and learning about their body, that they have tools they can use at home first. And then they know like what supports are going to be important to help them get back into balance more quickly. So it's like it's like you don't get tossed as far out of balance, and then you come back more quickly.
That's such a great point. It's almost like things bounce off of you, like daily stressors, whether they're physically or emotionally, they bounce off you easier. Yeah. Because acupuncture, it's both physical and emotional support, right? Right. Where, correct me if I'm wrong, it does help with aches and pains. 100%. as well as, moodiness if you're on your period.
Yeah, for sure.
Or if you're like overly stressed. So I feel like it is just such a well-rounded practice for supporting you both mentally, emotionally, and physically.
Yeah. I mean, it really covers all the bases.
Yeah.
I was just talking to a mom yesterday who's newly pregnant, and she was like, I was like, how's your mood been? And she was like, oh my God, I've been so just angry. And I was like, okay, that points to a certain system and pattern, right, in my mind. And then I was like, well, are you angry about things that you would normally be angry about and it's just more escalated? Or are you angry about like things that wouldn't normally make you upset? You know what I mean? Like, does it seem like it's kind of out of left field, or does it feel like it's normal and like things you want to really talk about with your partner or whatever, and then, but just extra? And she was like, oh, that's a really good question. So we got to dive in and like help support that a little bit of like, okay, you're not totally off base and being upset about these things.
Yeah.
And then we can help smooth out how that feels in your body. Because like I can't take the stress away, but acupuncture can help how the body responds to stress.
Alleviate it a bit. Make it a little lighter, right?
A little bit lighter and a little bit more clear of like what's needed.
Yeah.
Because I think a lot of times, especially in like the nervous system conversations right now, which I think are so important, there tends to be an overemphasis on like, we need to be calm and zen all the time. Really what I see in practice is we need to be able to oscillate between the highs and lows of life. And like we need to be able to hold more and like increase our capacity for life. It's not about being zen all the time because, if you're being chased by a tiger, like you need to be able to run. You don't want to be frozen in that, right?
It's more of like how to maneuver through it.
Yeah, it's
easier.
Like
and not hold on to it. And I definitely hold on to things going on in my life, and I'm like, can I just like release it? I need like we can only control so much in our life. We can't control the stressors that come to us, but we can control how we handle them.
Right.
And so that's why I love acupuncture, therapy, all
the tools, right?
Now is probably a good time to tell you. I was going to tell you this in our session, but I don't know what it is. I think it's just the final weeks of being pregnant. My threshold for just patience, and I've been so bitchy, or I've just like felt on edge,
like a little sharper.
And I'm like, it's the last few days. I'm like, is it my hormones like all over the place as I'm nearing the end? But even this morning, my daughter, I got dressed, and obviously, like if anyone's on camera, my jeans are not buttoned and they're folded over. I'm in a big white t-shirt. And I thought Aspen looked at me and was like, Mommy, you look so cute, because she usually compliments. And I was like, thanks, baby. And she was, no, I said, you don't look so cute. And she's like, you need to look like this. And she like shows me her outfit. And I saw red.
Brutal.
I was in my head, I'm like, are you kidding me?
Yeah.
Like, and I was like, didn't have my coffee yet. And I was kind of joking with her, but I was like, Aspen, don't mess with me this morning. Like, come on, girl.
Let's not do that.
Let's not do that. That is just a dagger to my self-confidence right now. I'm so uncomfortable. Yeah. And Scotty was like, it's also the day we're recording this. It's April Fool's Day today. So Scotty wrote me a note next to my coffee this morning and said something of, I'll spare you today, and like, I won't play a joke on you for April Fools. And after that, reading that, I was like, thank God, because I would probably be so mad. I'm just in like this defense mode right now.
You know what I hear like, though,
why?
as your practitioner, I'm like, oh, that's so great.
I feel like I'm the problem right now.
Oh my gosh, no, because the energy of birth and like what you're like literally prepping for in the next couple of weeks is the wood element in Chinese medicine. And like we need to have, it's like the same energy we're in now, like springtime. It's like that bursting through the soil. Mm-hmm. It's that like forward momentum. Like it needs a lot of energy, and it when it feels stuck is when we feel that like anger and frustration. But the fact that you're kind of stepping into like feeling more wood is actually really healthy. So good job.
Okay, well I feel I'll take that. I kind of needed that, because I was like, oh my gosh,
I feel so normal, maybe even good.
It's like pregnancy rage a little bit, but it's more, I just feel testy.
Yeah,
and I'm like a little sassy, and then I'm also emotional.
That's
like
wood.
Aspen didn't want to give me a hug and a kiss last night before bed, and I found myself almost crying. I was like, I just want to go to bed. It's a lot. So I'm
It's a
excited
lot.
I'm excited for our session today. Okay, so I want to hear about your approach and how it may change, let's say between pregnancy, end of pregnancy, and postpartum.
Yeah.
Do you have different goals within each one?
Yes, for sure. So as a woman moves, so sometimes we'll kind of graduate people at second trimester. So if I see, especially if I'm working with someone going through IVF, I'll see them weekly for the first trimester, and then I might graduate them, quote unquote, or give them the option. There's no like plan for second trimester if everything's going well, unless they come in, they have like back pain or swelling or carpal tunnel or something, we can work on that. And then I always have them come back at around week 34-ish. And then we start working on, like last time we were working on, I described it as working on your energy first before we start kind of inviting baby to come. So I think of it less like labor prep, I think of as like an invitational series where we're slowly increasing the volume of the invitation. Like a lot of times I'll get calls for acupuncture induction, which is something, you know, people can read on the internet. It's like,
Okay, so
acupuncture can help.
So I have $1 million question for you.
Yes.
Can acupuncture induce labor?
Yes, and I think would be my answer to that. Yes, it can. And I've had patients like walk out of the office and then go into labor that night, and that's like the dream, right? And it's also not like Pitocin. So I always tell people like we're working with your energy, but we're also working with the energy of the baby, and the baby has its own timeline. And so a lot of times part of the discussion with moms, you know, in those weeks before baby comes is like, okay, this is really about the surrender. So it's like, yes, you could do all the things and you want to feel like whatever level of that feels good to you. And we also have to, like motherhood, right? Like we have to keep surrendering to a certain degree, like our control of things.
I was about to
it's
ask.
that like little dance of like, okay, like we're going to sort of request to the baby almost. And we can, yeah.
It's like more of a helping hand. I was going to ask, do you find a lot of moms that come in the final weeks are looking for more of the control aspect rather than just the support? More like, I want to get this baby to come, and you kind of have to guide them into, well, let's just support the journey of when the baby's ready and we can do our part.
I think I see a mix. I think the people that have worked with me before come more for the support because they know a little bit more, but people that coming in off the street who don't know and have, you know, a friend told them or like they read it on the internet, like they're more like, get the baby out. And I'm like, okay, let's talk about it. Because one session is probably not going to do it unless the baby's like kind of already ready.
Yeah.
But there is research showing like decreased C-section rates and like lower active labor time with acupuncture before labor. So there's, you know, physiological benefits also.
Okay, so let's distinguish the difference between, I guess, labor prep when working on my energy versus the baby's. Is that, so I'm now 37 weeks where you said that today we'd start kind of encouraging the baby, inviting the baby in. What's the difference between what you did to me last week and then what your game plan is for today?
So last week we were really looking at like, do you have the energy levels in the right places, that high enough? And like before we were talking about like, is there enough energy? Is there too much energy in certain systems? And then is anything stuck? Those are kind of the three big categories that we look at. And then there's, you know, organ systems and stuff within that diagnosis and stuff. But then today we start to look, you know, like I'll ask more about like, are you having any Braxton Hicks? Like, some people do cervical checks and some don't. So we'll check in on that and see like, is the baby in the right position? Obviously, you know already. Is like the cervical ripening happening? Like, is the baby a face? Like, what levels are all of that? And then the points that we use are, actually, oftentimes they're points that are contraindicated in pregnancy, so to speak. And they're ones that have more of a stronger downward energy to them. So like the point at the top of the shoulder or like one at the ankle, like just above the ankle. Those are ones that have a really strong effect like on the uterus and also a downward effect.
So is that the goal, is kind of encouraging the energy to flow downward within, like, that's the way you birth?
Yes.
Okay.
Just like earlier we were talking about this one up here, like first trimester we're wanting to lift, lift,
hold
and
everything.
Hold. Yeah. Like just lift.
Now we want to push it down,
and now
baby.
We're like, okay.
Get it out. Shoot that baby out,
yeah,
please.
Right.
Sneeze it out would be the goal, right?
Yeah, totally. And then easy recovery.
Yeah.
Quick and easy recovery.
So can acupuncture help, I don't want to say speed up labor, but help have an easier labor experience and maybe pushing time?
Yes. Yeah. And that's where they look at active labor time, and they'll show that acupuncture has benefits, which is great.
Amazing.
I know.
Well, let's dive into labor then a little bit more. So when your sessions are done, just say you typically 37, 30, whenever the baby comes.
Yeah. You
mentioned that there's certain points in the body that a mother or their partner can do to help during labor. Do you want to talk about those?
Sure. This point right here between these bones, like
in your fingers, like your thumb and your index for people who aren't watching.
Yeah, for people who aren't watching, between your thumb and index finger, and it's closer to the index finger actually than the thumb. But really, if you just massage with a decent amount of pressure in that area, it's often a little bit tender. It's really great for pain anywhere in the body. So just a nice point to know about in life also.
That's the point for like migraines as well too. I spoke with someone else during a podcast convo about that point. I forget who it was, but we were talking, and I remember as a little girl my mom always used to do that to kind of divert my migraine pain.
That's so cute. I love that.
Yeah. So that's good for labor too.
Yeah, amazing for labor.
Are there any other points, or is that the main one?
So the sacral, anywhere along the sacrum, I mean, there are specific points, but really getting in anywhere in like the little holes that are in the sacrum is great. And then there's a point from the ankle bone, from the middle of the ankle bone, 4 fingers up, so just one hand, and then right next to the bone. And that's spleen 6. And that has 3 different channels that connect there, and they all go to the womb, to the uterus. And so there's a lot of different effects that each of those channels brings, but this is a great kind of collective point for people. And I'll just have moms, massage this throughout the day in those last couple of weeks. Ooh. So it starts to be a little bit more educational, like in the last couple of weeks. So like, okay, this is what's coming. These are some points that you can do to support your, your labor, coming in labor pain and progression. And then the postpartum time, I don't know.
Yeah, let's dive into postpartum, because I'm nearing that, and that's where I'm feeling like I personally am going to need the most support from you.
Yes.
I struggle with my postpartum phase, and it lasts a very long time because it can be such an emotionally and physically intense experience. Yeah. And especially
so much going on.
There's so much going on, and the big hormone shifts that they say happen within 72 hours after giving birth. Yep. The physical pain and healing, and then also things like baby blues or postpartum depression and just feeling overwhelmed. Yeah. I feel like definitely first time around as a new mom, but then also every single time there's new challenges, there's new things that arise when you're evolving as a family and bringing in another member. Yeah. So,
and every pregnancy is different too.
Yes.
So it's like there's a lot of factors.
And I bet that your birth experience plays a factor in all of that as well too. Like sometimes there's birth trauma. Yeah. Plans never go according to plan. There's some guilt sometimes. There's some mourning sometimes. And we hold
anger sometimes.
And we hold on to that. I remember I've talked about this a lot, I think, on here, but I was so unhappy with my birth with Bash. And I found myself, I realized only the times when I started talking about it, how much trauma and sadness I was holding inside of me without noticing. Yeah. Because every time someone would ask me about it, I would just start bawling my eyes out and be like, I'm really okay. I'm fine. And then one day I was like, I'm not fine. This has been 6 months and I'm still crying over this. Yeah. And we don't realize probably what that's doing to our body holding that in. So I could assume that acupuncture could help move through a lot of that.
Yes.
Right?
Yeah. And some of it is giving a space for it to be okay to be upset about those things, because you also, have this big heart opening. And that's something that's really fun with Chinese medicine too, is there's a direct channel that goes from the heart to the womb. And I'll often talk to actually fertility patients around like the importance of doing things that make your heart really just light up and be so joyful. Like that is actively supporting your fertility. And so when it comes to labor and birth, like we all go in, aside from everything that we know about what can happen and stuff, we all go in with our ideal picture of what it's going to look like, and this kind of like ideal scenarios. And then I always talk to patients about that too, like, yes, like make the plan. And we talk about that too with healthy wood. It's like it's the liver and the gallbladder in Chinese medicine, and they call the liver the general. So he like makes the plan, or she makes the plan, going into like a battlefield or something, right? But then like as soon as you get out, like that you're gonna have to just go with whatever shows up, and then it's gonna be plan D, right? Mm-hmm. Birth is kind of the same. And it's that energy of planning and surrendering that goes together. And then acupuncture can really help with that emotional tie between the womb and the heart, and giving that a space to be like, yeah, like that really sucked.
Yeah. So outside,
you don't have to pretend that it's fine.
That's true. Like giving
a lot
space
of times
to
we feel like we have to say
it,
it's fine, everything's fine, I'm fine, I'm good.
We always love to say, we always love to say I'm fine.
Yeah.
And 9 times out of 10 times out of 10, we're not fine.
And there's some like, okay, like certain situations, like you don't want to get into it and like start bawling, right?
Yeah.
Like I cry all the time, so like I'm fine with it.
Wait, what zodiac sign are you?
Sagittarius.
Sag. Okay. I'm a Cancer and I cry all the time. So
my brother's a Cancer.
So outside of that emotional tie from the heart to the womb, what are other ways that acupuncture can benefit a woman after birth?
So postpartum in Chinese medicine is huge. Also another piece that I want to be talking about more, so I'm glad you asked about this. Postpartum is like the obvious immediate benefits, like energy, healing of the just physical trauma of birth, mood, digestion, milk supply, like all of those kind of postpartum things. We also look at it as, how do I say this, like a direct investment in your menopausal transition. And so there's a way that the women who are really cared for and nourished in their postpartum, and are, take that time to be slow and to heal and to, eat the warm foods and do like all of those kinds of things, have an easier time going through perimenopause, essentially.
Interesting.
Yeah. So it's so important. And it's really hard nowadays because the tendency is like, oh, like bounce back as soon as possible and like get the baby, like go out and like be out in the world. And I'm like, okay, or you could stay close to your bed, for like a month, like take we call it like the first 40 days after birth is kind of this window. You really, I think, could go into like a 4th trimester and looking at that as like a really tender time that you're still needing a lot of nourishment, so that you can, be 6 months postpartum and start to feel like, oh, okay, like I'm not feeling as tired, I'm not feeling as emotional, like my cycle,
And do you feel like that 40-day kind of like rest and reset period helps balance hormones quicker?
Yeah.
I feel
part of it, I think, goes to that, like the physiology of like there's less stress.
Yeah.
I mean, there's enough stress just having a new person in the family and like sleep cycles and all of that. There's some stress, but you're not adding in like all the outside world stuff. Mm-hmm. And in Chinese medicine, like they really actually they like historically would encourage women to like not watch negative news when they're pregnant and like really kind of protect the mental health of the mom. That's kind of how I translate that to like modern times, would be like, yeah, really protecting your scrolling.
It
nowadays.
Makes sense because like, I've also heard, yeah, I've also heard that after a woman gives birth, it's almost like your body is open.
Yeah.
Almost like open to receiving. So you have to be really specific on what you allow in,
Yes.
negative energy will be absorbed. Or that's why they say to eat warm foods rather than cold foods, like smoothies. And so this time around, I'm really trying, in a perfect world, I'm really trying to rest as much as possible, take care of myself. Because the last 2 times, I spoke about this, I think, on the last podcast episode from last week, but about how a lot of like my overwhelmment and probably triggers for my postpartum depression and anxiety was because I was rushing to get back to the outside world and rushing to get back on my feet doing the things I was doing before.
Yeah, because that's settling almost too when we go back to what was like normal.
Yeah, it's familiarity and a sense of like, oh, I have bits of, you know, you're grasping at straws of who you were before to feel somewhat normal. No one ever really feels that normal postpartum, or at least it takes a while. You're not supposed to.
It's a total transformation each birth.
So this time I'm trying to promise myself to be like, okay, let me see how much of this 40 days rest I can do, and then focusing on the foods and what I'm absorbing from the outside world. Just because it's
balancing that with some grace, because you have 2 kids
and school drop-offs,
and you know, life is still there,
exactly. But like, just I guess,
can you put in some supports?
Like being more conscious about it, and making sure this time that I don't lose myself in the shuffle of caring for 3 kids, and making sure, you know, I am setting up at least, you know, if I could commit to 1 acupuncture appointment a week, if that's my one thing to do for my body,
amazing,
and then, you know, my therapy when I can, asking for help when I need.
Asking for help is huge.
Fresh air.
Yeah. Do you feel like that's hard in your
asking for help? I
know a lot of moms struggle with that. It's like feeling like we need to be able to do it.
I think it's a universal feeling for moms, where I learned this with each pregnancy and baby, that we are not meant to do every single thing, even though we feel like we're supposed to. You know, you have this sense of pride where like, well, I'm the mom, I should be able to take care of this baby on my own, or I should be able to,
and the house and the like whatever.
And in reality, there's absolutely no way, and you're not any weaker or less of a woman by asking for help. I think it's actually, you're more powerful by being like, hey, I need this. And I need this to take care of myself, because what I've learned is when I'm not okay, my orbit, nothing is okay.
So true.
And so in order
when
for
mom
me,
is off, the whole house is off.
Well, also like I'm a nurturer.
Yeah.
And I love to take care of everyone around me, but I can't do that if I'm not okay. And so then it just spirals, where I feel so bad about myself because I can't take care of everyone around me, and it's just this whole ripple effect. So I promised myself again this time around, like little things every single day that fill up my cup, and not rushing not rushing to prove to myself that like, oh, I need to be back in where I was in my career 3 weeks later. Or, you know, I remember my first time around, I was pumping during a call 4 days after getting home from the hospital, like on Zoom calls.
I hear that so much.
I look back and I'm like, why did I do that? I was stressed. My pump wasn't working. I had to turn the camera off. The baby started crying, and
it's just chaos.
That could have waited. That really could have waited. And so, anyways, it'll be almost like my little experiment this time, testing me taking care of myself more, being conscious about it, and seeing how that plays out with my hormones and my postpartum depression that I typically fell into and all that. So I'm excited. I wouldn't say I'm like excited, but I'm intrigued. I'm so curious.
I'm so curious.
Yeah.
I've seen in clinic such a big difference when women can create that space to just kind of slow down. In whatever way they can. And then seeing, you know, where they can ask for that help, and then leaning into community, you know, wherever they can. Like I recommend things like New Mom School for a lot of new moms or second time moms, just to have some outing that you're doing that's like, you know, I'm going to meet other moms in like a similar age group going through similar things with their kids, like, you know, or leaning into a friend group that you have that's dedicated and knows, you know, just how you like to be supported. Right.
So we've kind of touched on acupuncture postpartum for the physical healing. And we've touched a little bit on the emotional internal shift. Is there anything else you see women experience by using acupuncture to support postpartum, maybe with their nervous system, or do they react to, certain situations in the newborn postpartum days in a better way?
I find, and it's nice when moms have some kind of comparison where they have like a child they had an experience with that was like, oh, I had, a really hard time after birth, and then they have acupuncture. It's different. So I have seen a lot of those. And what I think I would describe it as is like they have more capacity, or like more space for grace. That's what I always talk about. It's like they're more okay with the messy, the dishes didn't get done, like we're late to drop off. It's like in the grand scheme of life, like it's all going to be okay. Like, you walked your kid in half an hour late, like they're fine.
The setbacks don't feel as heavy.
They don't feel as heavy. Exactly.
That makes sense.
It's a great way to put it. It's like you just kind of roll with things a little bit better. Yeah.
So a lot of women postpartum, I feel like, hyperfixate and stress about their milk supply and making sure that they have enough to produce.
Yes.
I've seen some research out there. It is limited, so I'm excited to get your perspective.
Yeah.
But I have seen some research that there is a connection between acupuncture and milk supply. What is your take on that?
I see it do absolutely miraculous things. Like I would say regulating milk supply. There's a point, actually, I don't know if you guys are watching, but on the corner of the pinky nail, where the bottom of the nail meets the outside, like lateral part of the hand, if you press right there, and you could dig in with your nail at home just as like an acupressure technique, that point, we use it for one thing, which some of the points are multifunction and some of them do like one job. This one is for regulating milk supply in the body. And so we'll use that point as part of like a whole treatment when someone comes in, but it can help to increase milk supply. It can also help to decrease milk supply, which is also an issue that I see a lot, where women just have so much milk that the baby can't take it in fast enough. And so they actually need to slow it down a little bit. It can do both, which is cool.
I'm definitely going to be coming to you for that because I've struggled. My milk supply is so low.
Yeah.
And so I've always, almost from the very beginning, even with a lactation consultant, had to supplement. And so this time I'm not putting
different this time.
I'm not putting any pressure on it, but I'm just curious to be like, okay, like without over stressing about it, is there a way of me doing more intentional work to help support?
And that's exactly the balance, right? Because if it becomes stressful and something that we're ruminating on, it doesn't help. It actually probably has the opposite effect of what we're trying to do. So the stress hormones are going to kick in, and then the milk supply will still drop. So you have a good plan for that already. But yeah, this point is great, and the research part is interesting because I think acupuncture as a whole is challenging to research, partially because of funding. So there's not a lot of studies that are being funded on like a larger scale. So there's a lot of research out there on acupuncture for various things, and that's where we will see like insurance companies paying for, low back pain or nausea during chemotherapy, like things that have been able to be put into a bigger scale study and then recreated again, right? Because you have to do it more than once. It's not like you do one research study and then it becomes standard of care. You have to do it multiple times. So one is like a funding thing, and then the other piece is because we treat in a very individualized way, it's really hard to do a study on like PCOS, like we were talking earlier, because I'm not going to do necessarily just one set of points for all of those people. It wouldn't be how I would actually treat in clinic. So if you're trying to fit acupuncture in, it's like square peg round hole kind of thing. Like it's useful, but also, I don't know. I teach the research classes we were talking earlier at the university in their doctoral program, and we look at the research that's out there and we'll use it as a means of conversation and, looking at like what points they used and what were the outcomes and treatment methods and stuff like that. And I love that, but it's also not necessarily something that I could bring to an OBGYN and be like, okay, if your patient is having trouble with milk supply, like 1,000% this research study shows that this is definitely going to do the thing, right?
Yeah.
If that were the case, it would be standard of care already.
Yeah.
Right. So
Is
we
that
can
why...
look at like where the data points, and we can look at like sample size, you know.
Yeah.
We can use it as a...
Is that kind of why a lot of practices don't accept, like insurance doesn't cover acupuncture? I've always been curious of that, because there's
a lot
so...
of it. It's like some of it's legislation and...
Yeah.
Yeah. Some of it is politics and having...
I feel like it all should just be a part of like pregnancy and postpartum support for women included. Like it's not just like a nice to have. Sometimes it is a necessity of needing these types of things.
And there's some real things that we can make a difference in.
Yeah.
And that in the long term costs way less money.
Yeah, it's true.
Like women with fibromyalgia who are struggling to get pregnant, like acupuncture and Chinese herbs, like some real success stories.
Way cheaper than IVF.
Way cheaper than IVF.
Yeah.
Way cheaper than, and so much less heartache.
So for someone who is about to be in their postpartum phase, or maybe they are right now, when can you start acupuncture after giving birth? Like, what's the timeline like?
So, I mean, I've seen people at home. So sometimes acupuncturists will do home visits. And I know there's a couple of women locally who go to the family's house and do what they call mother roasting, where they do a lot of moxa and like warming techniques. It's a bit of a balance. I always tell patients, like, I want to see you and support you postpartum. I also want you to like be really restful and like snuggled up in bed. So whenever they feel, I cue them, like, whenever you feel like ready to be up and out. Like sometimes women will come, if they have a really challenging birth, they'll come maybe 2 weeks postpartum, and this might be like their first outing, and they'll come and see me for acupuncture and then go home. So, I don't think there's a too early time, but I definitely encourage them to use their intuition and
when they're feeling ready for an outing, or
or
a need for acupuncture comes up.
Like milk supply things. There's also, we could have a conversation too about like colic and things like that can just be so stressful. And
so do you do acupuncture on the mom or the baby for colic? Baby. Okay.
Yes. We don't always use needles in pediatric acupuncture. For newborns, you don't necessarily need to, because their energy changes really fast. So we do like acupressure and things.
Cool.
Yeah.
Well, I'll definitely be coming in for that. You need to make packages for these types of things, like a mom and baby. That would be amazing.
And I always tell people to bring the baby. So if it's a newborn, we'll either schedule it like when there's like not people coming in for fertility. I do try to be sensitive of that, because I don't want to have
overlap.
I don't want them to cross in the waiting room. So we would just schedule it so that baby could come. And the tables that we have here sit up, so mom can rest and hold baby and nurse if they need to. And I would just do little press tacks on any arm points instead of actual needles, so they can have free movement of their arms.
Amazing.
Yeah, it's really sweet.
That's awesome.
And then if I've worked with them for like a while, it's just so delicious to have the baby come in and be like, oh my gosh.
I can imagine. It's so rewarding. It's like, I worked on you in the womb and now you're here and now you're 6 months.
You're outside. Yeah. It's really cool.
I love that. Well, thank you so much for this conversation.
It's been super fun.
Lucky for everyone listening, if you aren't local to Orange County in California, Dr. Christine, one, she is on Instagram where she posts a lot of information. And two, she recently launched her own podcast, like a month ago?
February 17th.
Okay.
Yeah.
And what's it called?
The Tao of Humaning.
The Tao of Humaning. I love the name. What kinds of topics do you cover on there?
I mean, really, it's kind of a space to talk about all of the things of being alive. And a lot of it is my lens of, Chinese medicine's view or Taoism, which I've studied a lot of. And then I bring in research, but we talk about all these kinds of things too, like hormones, emotions, wellness, all of that.
Love it.
Yeah.
Well, where can everyone find you, your website, your Instagram, and obviously now your podcast?
Yeah. So the Tao of Humaning is on all the podcast places. And I also do a video option too. So it's on YouTube, which is fun. My website for the clinic is whitephoenixwellness.com, and my Instagram, I just changed my handle, so I have to think now. I think it's drchristine.sanmiquel.
Great.
Yeah.
I'll link all of that
simple.
too in the description so people can
go.
just clip, but I always like to hear it from you first.
Connect.
Well, thank you so much. This has been great. And now I get to do my acupuncture treatment. Thank you guys so much for listening. I hope this was very insightful and got you feeling all calm and regulated and maybe booking some acupuncture for yourself to treat yourself because you deserve it.
Totally.
Talk to you next week.